So I've often been asked why our speech therapists are treating throughout this building. And I think it's because our concept with speech and language therapy is maybe a little different than most. Some places, the speech therapists, even the OTs, will have a room, and most of the treatment is just done in a room. They might have one small gym space, but typically they're in a room. That is not at all our concept here. We have a lot of friends with sensory challenges, so you might see a speech language pathologist working on language inside a swing, or they might be going down the scooter board ramp, and I often see them up on the structures. So they are trying to meet the self-regulatory and sensory needs of your child so that they're able to elicit language. So this is just one area you might see them. So another area you might see a speech language pathologist is in the feeding room. Our OTs sometimes do feeding, but many of our speech therapists are trained in feeding. So this is the feeding room. It's full service. It's got a pantry with a lot of feeding items. One thing that we try to do is we don't want to make it strenuous on our family, so we order in food every week so that it's here for you. It can be real stressful in today's day and age, even getting the type of item you want to use for feeding therapy. They have all kinds of food in here. They're usually doing a food palette. They also have a lot of their different chewies and different brushes and all the oral motor. They have a magic bullet that does smoothies also. So another area that you might see a speech language pathologist is in the apartment, because many of our SLPs are working on function. They're facilitating language or functional communication. This is an area of function. They might be doing a cooking activity. They might be folding clothes. They might be doing a game here at the table. This is an area where I think in any area you can elicit language, but this is a very functional part that we do with a lot of our young adults. So you're probably wondering why we're in the pool room and we talk about speech and language. You would not believe the amount of language that the water facilitates for our clients. So it doesn't mean that SLP is going to be in the pool necessarily, but they might be standing in the sidelines and having a conversation or working on skills in the water. And yet another area to facilitate language is outdoors in play. So we have all of our equipment out here, and they will ask them to describe it. What do you want to do? How does it feel? All of those different things can happen in play outside. We also have our core boards out here because they do a lot of language out here on device. So we have Proloco, and then we have LAMP. So that's why we put these up here so that our device users are able to communicate. And another spot is a treatment room. So we have a couple of different treatment rooms that speech really like to use. This is actually their testing room, but they also do social skills in here, and they'll use it for telehealth, and they'll may even be sitting on the floor. We never know. But speech can happen in a room also, and typically they end up in the rooms after they've done all the different activities they need your child to do so that they can focus and work specifically on language-based activities. So this is another one of our speech rooms, and it's got a little kitchen and it's a pediatric area, and of course it is in use because they're treating in there. So again, another thematic place that your kids can have treatment. So just remember, language doesn't only happen in a room, it happens everywhere. You communicate all over the world, out in the community, at home, everywhere. So our speech therapists are flexible enough to try to meet all those different environments for your kiddos, because we want to make sure they're generalizing those skills everywhere.